This is my capstone and 5-year plan. Darla, Mendoza. Lamar University, Nursing Program 4580, Practicum Synthesis of Professional Nursing. Instructor, Dr. Nancy McAfee. This is my professional bio sketch. I returned back to school as a second career goal after being laid off from an oil and gas company that I had worked for for 10 years. This, however, turned out to be the best career move I could have ever made. I enjoy nursing and I feel very fortunate to be able to love what I do. I've never considered working in the medical field before, although I do have 2 sisters who are nurses, each having different nursing paths and also enjoy what they do. So along with their support and that of my husband and children, I began this journey back in 2002. I graduated with my ADN from North Harris Community College in 2004 and began an internship as a graduate nurse in the emergency room at Houston Northwest Hospital. I am still employed there, but now work in the perioperative department as a pre-op PACU nurse. I cannot imagine working in any other career than in nursing. I enjoy learning, teaching, and caring for others. My learning outcomes. The Lamar University Joanne Gay Dishman School of Nursing is well known for its prestigious nursing program. The nursing program stands by their motto, a spirit of caring with vision of excellence. Along with the vision of high regards in nursing education, unity with the community, with the mission to educate students to be naturally professional nurses and practice through meeting learning outcome and the curriculum. Nursing theories and online education. In viewing Dr. Tess McAfee's videos on the various types of nursing theories, helped me gain a broader view of nursing interventions, client assessments, patient-focused care, and an overall understanding how nurses can impact a patient's ability to cope with illnesses. The Differentiated Essential Competencies APA paper. This assignment gave me insight on how the nursing profession is governed by various programs to fulfill the patient's needs in a safe and effective manner. For example, the Board of Nursing oversees the competencies of nurses to deliver safe care to the Texas population. The aim of the DECs is to prepare graduates with the necessary decision-making tools and information to make the right clinical judgment for their interventions and behaviors. This also enlightened my understanding of the additional competencies that the BSN should prove compared to ADN. Discussion board on ethical issues. This provided me with the insight on ethical concepts and legalities of nursing issues. This taught me how to apply and resolve the 7 key ethical principles of nursing in the clinical setting. A couple of examples include providing autonomy and fidelity while ensuring their rights are protected under the laws of legal, ethical, and moral obligations for the best possible outcome in interest of the patient. Goal is 94%. Nursing 4316, Comprehensive Holistic Health Assessment. This core course tested my learning and teaching objectives through the Shadow Health virtual teaching program by evaluating and assessing all age groups with various compromised health problems. This teaching tool improved my clinical assessment skills as well as improving various aspects of how to utilize therapeutic communication when interviewing patients. It enhanced my critical thinking skills by presenting complex cases. The head-to-toe assessments that were presented gave me invaluable feedback, which I was able to build on in my present clinical practice. Goal met 95%. Nursing Course 4390, Inquiry and Evidence-Based Practice Group Critique of Quantitative Study Article. This group collaboration involving an online project where each student participated in the research process. After all the necessary research information was written individually, according to our assignments, we then collaborated as a group via Blackboard communication. We critiqued a quantitative research article on glucose monitoring. Afterwards, we critiqued our peers' postings, feedback, and received valuable feedback in return. The readings and research assignment provided me with valuable learning outcomes on incorporating critical thinking skills, applying the nursing process, and researching evidence-based practices which will help me to have a broader foundation in my clinical practice. Goal met 94%. Nursing 4550, Leadership and Management, Global Health Online Topic Discussion. My topic was hepatitis A, which is more pronounced in the developing countries, primarily due to insufficient sanitation and limited access to clean water. The spread of this infection is mostly confined to young children, primarily due to unsanitary conditions and lack of access to proper medical treatment. In contrast, developed countries have low levels of infection due to improved sanitary conditions and access to medical treatment. Global Health PowerPoint presentation. Identified various nursing association memberships available, their mission, purpose, and initiatives. The importance of becoming involved within a nursing organization like the American Nurses Association. For example, networking prospects, ability to influence health policies, as well as leadership and career development opportunities. Goal met 98%. Nursing Practice 4620. Care of patients with compromised multiple health states. Practicum 1. Reflected on a young child with type 1 diabetes in a memoir reading, Needles. Practicum 2. Focused on providing holistic care through a multidisciplinary team and collaborative expertise for patients with diabetes. Practicum 3. Interviewed a client with type 1 diabetes and developed measurable goals, along with the adaptation theory, which perceives that illness and health are inevitable elements of life. Practicum 4. The insight I gained from those living with a compromised disease was to adopt a healthy lifestyle and remain compliant with all aspects of daily living. Discussion post number 5. Focused on thoracic trauma and the 2 stages of managing and assessing trauma patients. Readings included material from Med Surgical Nursing, Patient-Centered Collaborative Care textbook. Goal met 96%. Nursing Practice 4540, Care of the Communities. This assignment provided me with a better understanding of the standards of care, trends, culture of safety, influence of community health nursing, and the healthcare system. CBSL Civic Pride and Diversity Assignment. Emphasis on volunteering within your community and supporting community outreach programs to help those in a crisis. I value the knowledge gained with the many programs and basic services these programs offer to the community. Practicum Project Planning Form number 1 and Windshield number 2. Identify the at-risk special needs of a community aggregate. This project gave me a new perspective on community service by observing and interpreting my neighborhood to better understand the at-risk population. Practicum Project Teaching Plan. This teaching project detailed the importance of being prepared in the event of a natural disaster such as Hurricane Harvey in 2017. Utilize effective teaching tools like lectures, pamphlets, and a detailed list of the necessary supplies needed to evacuate during an emergency. The community's learning objective was to prepare ahead of the disaster by gathering important documents and the supplies necessary for one's own health issues. Goal met 95%. My 5-year plan is to graduate in December 2018 with my Bachelor's of Science in Nursing. In retrospect to my career plans, I, fortunately, love exactly what I'm doing now. I will continue to work at the Outpatient Surgery Center as a circulating nurse, where I have worked since 2007. I also plan to continue working at the hospital as a pre-op and PACU nurse on the weekends, where I originally began my nursing career in the emergency room in 2004. I plan on enjoying spending time with my new grandson and my new home, which my husband and I recently finished building in October 2018. However, considering my age, I have no plans on returning back to school, but as the saying goes, never say never. Presently, I will focus on taking a well-deserved and much-needed break and just wait and see what the future holds. Thank you, Darla Mendoza.